Hey everyone, welcome back to my channel. Today I wanted to talk to you guys about what lifestyle medicine actually is, why it's important, and also to go over some key landmark studies that have supported this specialty and pushed it into existence. So, lifestyle medicine is the practice of using evidence-based medicine and lifestyle interventions to treat and prevent chronic diseases. So these chronic diseases are things like type 2 diabetes, hypertension, obesity, and cardiovascular disease, which are the most common. So lifestyle medicine, think of it like a medical specialty. So you're cardiologists, nephrologists, rheumatologists, things like that. So this is a relatively new field, only came into existence about 5-6 years ago. Back in 2015 is when the American Board of Lifestyle Medicine was created, and in 2017 is when the lifestyle certification exam and process was implemented, and a year later we had our first lifestyle medicine intensivist actually come into practice. So lifestyle medicine specialists are clinicians who are trained to apply these evidence-based practices to treat and reverse these chronic illnesses, as I had mentioned before. Lifestyle medicine uses 6 pillars to encompass all of these evidence-based practices to treat and reverse these chronic illnesses. So these 6 pillars are exercise, stress relief, restorative sleep, avoidance of risky substances, positive social connection, and a whole food plant-based diet. So why does this matter? So the first reason is the cost of healthcare in this day and age. So the US alone back in 2018 spent $3.7 trillion on healthcare alone. So this cost can be attributed to hospitalizations, surgeries, and procedures, and pharmaceuticals. The goal of lifestyle medicine is to use lifestyle interventions to prevent hospitalizations and the use of dependence on pharmaceuticals to treat certain chronic conditions. So the second reason is planetary health. So lifestyle medicine supports the use of a whole food plant-based diet. So we know that livestock is a large contributor to carbon monoxide emissions. One study shows that livestock contributes over 7 gigatons of greenhouse gas emissions annually. So plant-based dietary replacements can reduce this per person greenhouse emissions by up to 80% and the use of water by up to 50%. Okay, so now I want to go over some landmark studies that are super key and important in lifestyle medicine. So these studies are called landmark studies because they were the first of their kind, and also they paved the way for lifestyle interventions to be viewed as a type of medicine. So the first study I wanted to go over is the Ornish landmark study in 1998. So this is an intensive lifestyle intervention targeted at patients with heart disease or atherosclerosis. So this was a randomized controlled trial. It included 48 individuals with atherosclerosis actually documented on coronary angiography. And they were randomized into 2 groups. So the intervention group were patients who received lifestyle interventions in the form of dietary modifications. This was specifically a low-fat vegetarian dietary pattern. They also received counseling on moderate aerobic exercise, stress management, and also smoking cessation. And mind you, these were mainly in the form of intensive education sessions. These diets were in no way strictly implemented in these intervention groups. So the control group were patients who just underwent a standard of care. So in these populations would usually include undergoing a statin therapy. So these patients were followed at 1 and 5 years, and the main outcomes were level of stenosis in their coronary arteries and cardiac symptoms. So for the results, they were pretty impressive. So in terms of the stenosis in the coronary arteries, in the intervention group, we saw a significant decline in the level of stenosis at 1 year, and that declined exponentially at 5 years. Furthermore, in terms of cardiac symptoms, at 1 year, the intervention group had a 91% reduction in angina or chest pain related to cardiovascular disease. And this was compared to a 186% increase in angina in the control group. So in conclusion, this study remains the first pioneer landmark study to exist in the field of lifestyle medicine. So it shows how cardiovascular disease has the potential to be reversed with intensive lifestyle interventions such as this. And fun fact, the study actually helped to medically reimburse cardiac rehab in Centers for Medicare and Medicaid. So the next landmark study I wanted to go over is called the DIRECT study. So this is a 2018 study in the UK that showed that intensive dietary interventions can actually reverse diabetes. So for this study, the population group included 306 individuals with type 2 diabetes and a BMI between 27 and 45. These individuals were not being treated with insulin. So these individuals were randomly divided into the intervention and control group. So the intervention group, these patients were instructed to stop their anti-diabetic medications and antihypertensive medications, and they underwent a total dietary replacement. So this included a calorie restriction of 825 to 853 calories per day for about 3 to 5 months, after which these individuals underwent a stepwise reintroduction of food, which occurred over the span of 2 to 8 weeks. So the control group were patients who were treated according to standard of care, which is usually just to continue the anti-diabetic medications as prescribed. So these individuals were followed over the course of a year, and after a year, the main outcomes that were studied were the A1C level, the rate of diabetes remission, and also weight loss. So after a year, the results for the A1C was pretty impressive. So for the intervention group, there was a rate of remission for diabetes of 46%. So that's almost half of this group went into remission for diabetes. And for those of you who don't know what remission is, it's when the A1C goes below 6.5%. So for a diagnosis of diabetes with the A1C, it's 6.5 or greater. So less than that is termed as remission for diabetes. So this is pretty amazing, because these individuals, remember at the beginning, they were completely taken off their anti-diabetic and antihypertensive medications. So this is without any kind of pharmacologic intervention, just dietary intervention alone. These patients went into remission in just a year. And this can be compared to the control group, where only 4% of these people went into remission for their diabetes. And of course, in terms of weight loss, there was a significant weight loss seen in the intervention group, which is not to be unexpected, because these patients were undergoing a severe calorie restriction of 825 to 853 calories per day. So the biggest limitation of the study is, of course, the calorie restriction that we see. So these patients were only restricted to 825 to 834 calories per day, which is very hard in terms of adherence over time. So what this tells us is that future directions for research should definitely involve looking at more whole food plant-based dietary patterns without a severe calorie restriction in these population groups. So there's a lot of trials and research going on with this kind of intervention as I speak, and I can talk more about them in future videos for sure. So what this calls for is large randomized controlled trials looking at a non-restrictive whole food plant-based dietary pattern in these type 2 diabetic patients to see how this can also induce remission in diabetes. So this video was just to provide an overview of these studies and of what lifestyle medicine is. There really is so much more to it, and I hope to bring more of that to you guys in the next coming videos, and definitely do more deep dives within the 6 pillars of lifestyle medicine, and talk more about landmark studies that have shown the evidence behind these lifestyle interventions. So I hope that this got you guys excited because it always gets me excited. Thanks for listening. If you guys liked seeing that content, please like and subscribe. It really supports my channel, and I'll see you guys in the next video. Bye.